are you today? Good. I'm Susan. I'm going to be your student nurse today, and we've got to get a few things done. But first, can you tell me and verify your name, date of birth, and allergies for me? Excellent. Perfect. So what I've done is I've looked in your orders that the doctor has for you today, and we need to get a nasogastric tube put in to let you have some pressure relieved off your stomach. Do you have any questions about that? Okay. It's going to take about 15-20 minutes. I'm going to walk you through every piece of that step. Before we get going any further though, I do need to make sure that you don't have any allergies. I see your band says that you do. Can you tell me what it is that you're allergic to? Okay. And have you ever had any surgery on your nose or throat, anything on your head? Any trauma? Okay. And then one last question before I get into the specifics of it. Can you tell me if you've had any stomach or bariatric surgery? Nope. Great. Alrighty. And let's see, I'm going to go ahead and get started with your vital signs though. So we're going to get your blood pressure. We're going to listen to your lungs. I'm going to put this on your finger too. It's just a pulse ox, they call it. It's going to measure your oxygen throughout the procedure. Okay. I'm going to go ahead and listen to your tummy as well. Make sure everything's good there. Okay, sounds are good. Definitely some distension though that I've noticed, and I think that's what we're gonna try to help with this tube. Okay. So I'm not sure if we've talked about this before right now, but I do want to go over the whole procedure with you. Okay. First thing I'm going to do is have you set up. Okay. And you let me know if you have any pain or problems with any of these things that we're getting ready to talk about, and then of course throughout the procedure you let me know. Okay, so we're going to get you set up nice and straight. So what we do have to do is insert a tube that's going to go down through your nose to the back of your throat and straight on down to your tummy. Okay, the most important part of all this is going to be for you to swallow the tube. Okay, it's definitely going to be uncomfortable as it passes through your nose. But I'm going to go ahead and give you your cup of water right now so you can drink, drink, drink when I tell you to do that, okay? That's going to be the biggest thing you can do to help with this, okay? Any questions so far? Okay. If you weren't able to sit up straight like that, we have a couple different positions that we could put you in that we would talk about. Okay. So first thing I'm going to do is get some clean gloves on, and I'm going to go ahead and measure the tube. That way we know how long it needs to be. Okay. And just by the way, this is not a sterile procedure, so but I am going to try to keep it as clean as possible. So when I open this tube after we get it measured, I'm just going to put it right back in its little package for now. So this part, I don't need to do anything, just kind of sit still for me. And what we're going to do is measure the tube to see how long it needs to go in to make sure we're in the right spot. Okay, and get my little marker ready. Okay, so the only thing I'm going to do is measure this from the tip of your nose. Still going to try to keep it a little bit clean. So tip of your nose to your earlobe, and then down to what's called the xiphoid process, yep, which is really going to be about the very, very bottom where the middle of your rib cage is. So by the mark, this is right at 50. So I'm going to mark that and keep this as clean as we can. So right at 50. And then the next thing we're going to do is try to figure out which side of your nose we want to put this in. Okay, so what I'm going to have you do is take this tissue and just kind of blow each side. Okay, and does either side feel more plugged up than the other? Okay. And I'm just going to take a peek both in your nose and at the back of your mouth. Okay. While I'm here, can you see if you have a response to this gag? Good. Perfect. And go ahead and give me a good cough so I can tell the difference between your cough and your gag. Okay. I'm going to go ahead and get you a little towel on. And I also will give you the basin that this comes with, just in case you get a little sick to your tummy. I want you to have everything you need just in case we have a problem, okay? So, you've got your cup. We've got our tube marked. I'm going to go ahead and get this gel ready, which it's really just a lubricant that's going to help the tube go down easier, okay? So we're going to put that there. Okay. So again, I'm just going to kind of walk you through this. When I start, I'm going to have you keep your head back a little bit, and then when I tell you to, I need you to lean forward and swallow, 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 swallow. Okay? If you're having problems during any of this, just raise that hand on the other side and let me know, and I'll pause. The other thing that we need to make sure is that we're going down the right tube. So if you start to cough or have troubles breathing, let me know right away. Okay? It will be uncomfortable, but if we get this done quickly, it'll be a lot happier off for us. Okay? Anything else before we get going? All right. Get this tied up a little bit so we have a little bit more of a curve. All right. Are you ready? Okay. Like I said, I'm going to go ahead and get this lubed up. When we get to the back of that throat, I'm going to have you lean your head forward, and I'm going to tell you to swallow, swallow, swallow. Okay? Are you ready? All right, head back. And back of the throat. So now that head forward, forward, swallow, swallow, swallow. Keep swallowing. Excellent. Keep swallowing. Swallow. And there we are. Perfect. Oh my goodness, you did such a good job. I'm going to tape this right quick so we don't lose our hard work that we did. Just going to kind of tape this up here for a quick second. We check everything. These tapes don't stick very well to your skin, but they're getting my glove, aren't they? All right, we're going to let that sit there for just a second. Are you doing okay? Your oxygen's good? Wasn't any sounds coming out of here? That sounded like air escaping, so far so good. So one of the next things we need to do is check to make sure that it's in the right spot. So we're going to try to get some of this stomach content out of there. Okay? Looks like about 20 is what we can get. We've got some greenish color. Set that out. And I'm going to test this right quick. Make sure that we are in the tummy with this pH paper. Yep. Looking good. Alright, so one other way we can confirm that this is indeed where it needs to go is to listen to this as it goes back in. We should hear a little swish. back on. Now for right now, we don't have to hook this up to what's called suction. We're just going to let that decompress a little bit at a time. So that should be good. And I'm going to go ahead and get your nose wiped down. Make sure you're comfy. And then we're going to get this just a little bit more secure, because the other thing that we have to do is to make sure that that's in the right place, which means we actually have to have X-ray come up and take a pretty picture of your insides to make sure that's in the right place. Okay. Okay. I'm going to go ahead and clean your mouth out too, see if we have any, get any dryness out of there. Nope, still not functioning. We'll pretend that's good. Okay. And then the next thing we want to make sure, again, with all your hard work and putting up with this, we don't lose that tube. So I'm going to actually pin it to your gown. Make sure we got a little bit of space for you. And are you done with your little towel there? And I will leave you your tissue right by your cup. We're going to take off your oxygen because everything went well with that. Do you want me to leave you the wash rag? Alrighty, and one last little thing. We got right to the line, so I actually don't have to change the line, but if I did, I'd draw that on there. Okay. Alrighty, I'm going to go ahead and change up my gloves. Actually, I don't think we need these anymore. Going to get my hands washed up. And the X-ray folks will be in just a little bit. Going to make sure that your collet's here. Do you want to stay in this position? I do need to leave you up a little bit, but if this is good, we'll leave you there. Okay. Let me know and we can put you back down a little lower if that feels better to you. Okay. So, bedrolls up, collet and reach. Thank you so much for letting me do this. I know it was not comfortable. I'm going to put all of your belongings right next to you, but besides that, do you need anything else right now? Okay. I'm going to clean up and I'm going to get this documented in our charting so everybody knows what we did. Put the date, time, and the type of tube that we used, which was a 14 French sump pump. And we had about 20 cc's of green, light green fluid out. And you tolerated it well, no complaints of pain. And we checked for placement with the gurgle sound. And it is just clamped off and pinched off, not to suction at all. And most important parts are, after all that work, don't pull the tube out. Follow any of your dietary and fluid orders that the doctor has for you. Okay? All right, thank you.